CSA 231 revision QESDONS3, with answers which one of the following opioid analgesics has the longest half-life, i.e. is the longest acting. 1 mark methadone. You might see in the AMH table included in the content that morphine has up to 24 hours listed as an approximate duration of action as well. However, this is only applicable to sustained controlled-release morphine preparations. Name the tricyclic antidepressant, TCA, that is most likely to cause anticholinergic effects. 1 mark amitriptyline. Name the drug that is most effective in treating the motor symptoms associated with Parkinson's disease. 1 mark levodopa. Name one drug that is used as an emergency contraceptive. 1 mark levonorgestrel or ulipristal. What drug class does tamsulosin belong to? 1 mark alpha-1 receptor blockers. Which tricyclic antidepressant, TCA, is most likely to be associated with orthostatic hypotension? 1 mark nortriptyline. List 4 adverse effects that can commonly occur with selective serotonin reuptake inhibitor, SSRI, use. 2 marks. Any of the following. Nausea, vomiting. Marks wouldn't be applied to both if both listed in an assessment answer. Only 1 point for nausea or vomiting. Diarrhea, insomnia, anxiety, sexual dysfunction, loss of libido are some of the potential answers. Consider what receptors are responsible for these adverse effects. List 2 common adverse effects that might be experienced by a patient taking dutastride. Include in your answer what drug class dutastride belongs to. 2 marks. Dutastride is a 5-alpha reductase inhibitor that converts testosterone to dihydrotestosterone, which is a potent androgen. We can extrapolate from this some of the likely adverse effects that might occur, such as impotence, reduced libido, ejaculation disorders. Breast tenderness or enlargement is less common and wouldn't be accepted as answers to this question. Explain the mechanism of action of beta-histine. Include in your response what beta-histine is indicated to treat. 4 marks. Beta-histine is used to treat vertigo. Beta-histine has a complicated mechanism of action, but generally it is a histamine analog that causes vasodilation, and it is thought that this reduces the endolymphatic hydrops pressure and also improves the blood flow to the labyrinth and disrupts the endolymphatic fluid homeostasis in the ear. Its action, i.e. agonist, inverse agonist, or antagonist, depends on the receptor it's acting on. It can have all of these actions depending on which receptor it's binding to. Explain the mechanism of action of varenicline when used for smoking cessation. 3 marks. Varenicline is a partial agonist at some of the neuronal nicotinic acetylcholine receptors. Nicotine then is able to bind to these receptors, decreasing the rewarding effect of smoking, and the partial agonist activity of varenicline means that the person experiences less withdrawal symptoms. Varenicline has common side effects that can be divided into 2 groups: GI side effects and CNS side effects. List 3 CNS side effects that can be commonly experienced by those taking varenicline. 1 mark. The main ones you might list are insomnia, abnormal dreams, nightmares, or sleep disorders. What drug class does tadalafil belong to, and what condition that we've covered in CSA 231 is it indicated to treat? 2 marks. Phosphodiesterase 5, PDE5, inhibitor, and it is indicated to treat benign prostatic hyperplasia, BPH, lower urinary tract symptoms, LUTS. List 4 common side effects that might be experienced by a person taking the combined oral contraceptive pill. 2 marks. The key word here is common. You might list any 4 of the following: breakthrough bleeding, nausea, vomiting, breast enlargement and tenderness, mood changes, headache, libido changes, acne, thrush, salt and water retention, which can increase BP. Note that there are less common side effects that are important, like increased risk of thromboembolism. However, these are not common side effects. Prochlorperazine is thought to act at what location to suppress vomiting, as part of what is considered its secondary mechanism of action. 1 mark. The chemoreceptor trigger zone. CTZ tricyclic antidepressants, such as doxepin, can cause potentially fatal cardiac arrhythmias if an excessive dose is taken. What mechanism is responsible for this adverse effect? 1 mark. Blocking the sodium channels in the heart. What drug class does vortioxetine belong to? 1 mark. It is a serotonin receptor antagonist. Which beta blockers might be used as migraine prophylaxis? 1 mark. Propranolol or metoprolol, sometimes atenolol. What action does mirabegron have at the beta-3 receptor, and what would it be indicated to treat? 2 marks. Mirabegron is a beta-3 agonist that leads to relaxation of the detrusor muscle to increase the bladder capacity, and it would usually be used to treat urge incontinence. Disulfiram inhibits which one of the following enzymes? Alcohol dehydrogenase cholinesterase aldehyde dehydrogenase monoamine oxidase type B catechol-methyltransferase. 1 mark. C. Aldehyde dehydrogenase. The step after alcohol dehydrogenase, name one dopa decarboxylase inhibitor. Why are they considered peripheral? 3 marks. You could name either carbidopa or benzorazide. They are considered peripheral dopa decarboxylase inhibitors because they don't cross the blood-brain barrier, BBB, and only act peripherally in the GIT and peripheral tissues to reduce the metabolism of levodopa.